Okay, hi everyone. Hopefully you can hear us okay. I think we're sharing mic. Great. So yeah, hi, I'm Sophie. I'm a data analyst at the Lambeth Early Action Partnership.
And I'm Rose, and I'm a senior researcher at LEAP as well.
And we're going to talk to you today a bit about the learning from the Lambeth Early Action Partnership. So our experience linking data across services to evidence improved parent and child outcomes. So yeah, just a little overview of our presentation to start. So we're going to sort of split it into two sections. So we're going to give a bit of background to the Lambeth Early Action Partnership and a bit of some details on our data and our approach to evaluation and some of the challenges that we've encountered along the way. Talk a bit about what LEAP is intending to achieve, and then present some of our preliminary findings around those outcomes.
So Lambeth Early Action Partnership, or LEAP, is one of the 5 sites in the UK that's receiving the A Better Start funding from the National Lottery Community Fund. So we've got a 10-year funded project. We are now in year 9 of it. And the aim is to improve early childhood development outcomes in the Lambeth local area. And LEAP does this, it funds over 20 different services, as well as a programme of capital sort of buildings and setting improvement, and also a workforce skill development programme. And LEAP services work with pregnant women and birthing people, directly with children aged 0 to 3, as well as their families. And we kind of give priority to families living in the more deprived areas and from ethnic minority backgrounds. And sort of 3 kind of characteristics, I guess, of the LEAP programme. So the first is that it's a place-based programme. So the map on the right left there is of our area. So this was initially based on 4 electoral wards that were chosen for the kind of level of need and evidence of inequalities for early childhood outcomes compared to other parts of Lambeth. And the place-based approach means that the services that we offer are hyper-local, so they're situated places where family are already accessing places like children's centres. LEAP is a collective impact initiative, so all the services and activities link together and work towards shared goals, and ideally families attend multiple services, and the aim is to provide sort of holistic support to meet a family's needs. And then the third sort of characteristic is that it's a test and learn programme. So over the course of the 10 years, we've developed these services, kind of looked at what's working and made improvements. And the aim is that we'll be able to add to the evidence base of what works in this space. So evaluation and learning are really key aspects of what we do at LEAP.
So yeah, that being said, it's not been without its challenges. So the LEAP partnership includes around 20 different providers, I think, which range from big NHS trusts working in Lambeth all the way down to small community voluntary organisations. So yeah, lots of people with lots of different approaches to data. No obvious unique identifier. I think a few people today have talked about the challenges of not having common identifiers, which meant that, in the early days, we couldn't link people across services, which then makes demonstrating collective impact very difficult because you don't know where people are accessing multiple activities. And the approach to data wasn't standardized. So different providers use different forms, different outcome measures, all that sort of thing. So we kind of needed to, work out how to address these things. And in terms of evaluation, there was a huge range of outcomes being targeted. And so we wanted to make this coherent to be able to tell kind of a narrative of how LEAP is achieving change in Lambeth. So our data integration platform has been one of the kind of projects that's been running over the last few years that's been an attempt to address some of these challenges. So the platform generates a unique key for people accessing our services, generated from different pieces of information. There's an algorithm that pseudonymizes people's personal information, which helps us to facilitate data sharing, for example, with NHS trusts, where obviously they have very high standards around information governance. It enables them to pseudonymize at source and share data with us. The platform also enables us to check for matches when people are uploaded to see if it's the same individual or a new individual, and it identifies families within our data, which enables us to link child outcomes to the services that their parents have accessed. The platform links lots of different types of data. So we have demographic data, attendance or engagement data, and also outcomes data collected by the different services. And we're currently in the process of linking to big administrative data sets for the wider Lambeth borough. So, for example, maternity records, health visiting records, and hopefully in the future, early years foundation stage and National Child Measurement Programme data. And that's going to enable us to look at longer term outcomes and potentially do some stuff with comparison groups as well.
So the other sort of approach to solving these data problems that we've been working on is our shared measurement system. So as Sophie was saying, initially services were sort of measuring outcomes in quite a disorganized way. And there wasn't really any standardization across what outcomes different services were aiming to achieve. So one way that we sort of approached this was with a nested theory of change. So each service developed a theory of change, and each individual service's theory of change nests underneath a overarching LEAP program theory of change. So the sort of outcomes from each services read up and down to outcomes that we're looking at across the program. We spent some time aligning the kind of data collection tools and measures across services. So trying to standardize measurement where we could, particularly with things like user data and feedback data. And then we also invested in simplifying data collection to try and reduce the burden on practitioners and really get them on board for evaluation. We set up a quarterly reporting system on Power BI, which enables us to feed data back in a really timely way to services. And these are used for learning and improvement more regularly. And this system we implemented in October 2021. So this is the theory of change at the program level. And on the right-hand side is our kind of overall impact, which is improving the outcomes for all LEAP children and the substantive improvement for those at greatest risk of poor outcomes. And this is sort of inspired by ecological systems theory, so looking at a kind of range of influences on children's outcomes and how they interact together. So the theory of change is broken down into 7 domains and then a sort of underpinning 8th domain around engaging families into the services. So that annual learning report is a piece of work we completed this past year, and it was the first time we had a look program-wide at the data from our shared measurement system. So some of the data is from the beginning of the program in 2015, and our cutoff point was March 2022. And we looked at, kind of everything we had to date. So all of those data types that Sophie spoke through, demographics, engagement data, feedback data from families, but also from practitioners who have taken part in kind of workforce development, and then outcomes data, which is a mix of knowledge and confidence questionnaires, which we developed in-house, and then validated more like clinical tools where we did pre and post analysis where possible. And looking at the theory of change again, the kind of highlighted 5 domains were the 5 domains we focused in on in the research, because this is where we had kind of the best data at the time of analysis. So we'll take you through each domain and just read through some key findings. So starting with that underpinning domain about effective outreach and engagement. So kind of all the work that LEAP does to get families into activities and services. And what we found is that since the beginning of the programme, LEAP had reached over 14,000 people. And on the right, there's a sort of sample of our services. So these are the services that are actually currently still live by strand. So we have, it shows the kind of holistic approach to early childhood development. And then above, we have some of the partners that we work with to deliver those services. And so a real range, so from Lambeth Council and local NHS trusts to much smaller voluntary sector organisations. And we found that, within that reach, we'd reached nearly 7,000 children. And LEAP's kind of stated aim at the beginning of the 10 years was to try and reach 10,000 children over 10 years. So that's really encouraging. And then just over 7,000 parents and carers and 1,681 practitioners so far.
Great. So I'm going to talk a bit about some of our outcomes data now for our sort of 3 domains on the right. So I'll start off by talking about domain 1, which is improving early child health and development. And this is the outcomes LEAP's aiming to achieve directly with children aged 0 to 3. So one of our services that is targeting outcomes under this domain is our Natural Thinkers service, which provides training in early years settings to support practitioners in providing outdoor learning and play for the children in their care, with the targeted outcome of improving child mental health and well-being. So practitioners use a tool called the Leuven tool, which is quite simple. It just measures involvement, which is kind of children's engagement or enthusiasm for different activities, and it also measures their well-being. And they do measures at the beginning of the academic year, and they repeat them at the end of the academic year to look at change over time. And so, we can see the chart here shows that sort of pre-post measure. And we can see that from the beginning to the end of the year, there's an increase in the proportion of children with high or extremely high involvement or well-being. This difference is kind of significant. We also looked at differences by gender. So we found that boys had lower levels of engagement at the start of the year, but by the end of the year, there was no significant gender difference seen. And the gender difference in well-being also reduced over the course of the year. So this is kind of really promising and potentially being something that might help to close that gender gap. With the thinking being that maybe, this sort of practical outdoor nature of the service is kind of, really engaging for boys. So the next domain is improving parental health and well-being. So LEAP recognises that in the early years, parents are a particularly important influence on children's development, and that supporting parents to have good health and well-being is going to be crucial to kind of improving child outcomes. And an example of one of our services that works in this sort of space is our enhanced casework service at the Gaia Centre, which provides holistic support to parents experiencing domestic abuse, particularly aiming to intervene early before abuse escalates. And this is sort of all around positive family relationships. So caseworkers work with their clients and at the beginning, so at the intake to the service, they measure psychological distress using this validated tool. And that is repeated when clients exit the service. And again, we see a really clear positive change over time, with clients reporting much lower levels of distress when they exit the service, which is obviously really positive. And yeah, no clients exhibiting kind of severe levels of distress at the end. So yeah, that's kind of the point there. And we also ask various kind of questionnaire questions around other sort of outcomes, and yeah, clients report that they feel safer and more confident in seeking help, and that their experiences of abuse have reduced. So the final domain we're going to focus on today is strengthening families' knowledge, skills and behaviours. So this is kind of ensuring that families have the tools that they need to support child development at home. And one aspect of that is 2 of our communication and language services, supporting babies' next steps and sharing real. And these are courses for parents and carers where they learn how to support their child's communication and language development, with the aim of improving home learning environments. So we know that home learning environments are a really important predictor, often sort of said to be more important than income or education level in determining children's outcomes later on. So we ask parents at the end of the service what kind of effects they've experienced, and kind of find an overwhelmingly positive response. One thing that we found is that parents and carers with English as an additional language were reporting a significantly more positive effect on their knowledge and confidence around creating a positive home learning environment. So it's kind of, positive that the service is helping to achieve change for some of those families who might be kind of most in need of support. Parents and carers doing this service, taking part in the service, also complete a validated measure called the Toddler Home Learning Environment Index at the start and end. So this is a questionnaire. It asks the frequency with which parents do different learning activities at home. So things like reading, messy play, shape sorting, singing songs, all those nice things. And we found a significant increase in the average score over the course of the programme, with messy play being an area with particular improvement, which is positive because sort of anecdotally we know from parents that this is something they can struggle with at home. We did see differences according to area deprivation. So there was, a significant gap between families from more deprived and less deprived neighbourhoods. And no evidence that this gap kind of increases or decreases, but there was a positive change for all families, with the caveat that this is based on a very small sample size to date, but we're going to be hopefully repeating this analysis in the future. So this chart just sort of illustrates that point that, over the course of the programme from session 1 to session 4, we see an increase in average scores, and that yellow line being parents from the most deprived quintile, and the other lines parents from the less deprived quintiles. Okay, so that's sort of the end of our findings. So that's sort of the analysis that we've done to date, which has been focused on these kind of pre-post outcomes. So in terms of limitations, we don't currently have that kind of counterfactual analysis. So we're sort of interpreting with caution in terms of attributing some of these changes to the services, but kind of taken as a whole with sort of our anecdotal evidence and qualitative evidence and feedback data, it's sort of building that picture of LEAP's impact. And this picture is going to be kind of further added to through some of these other activities. So we talk about the 3 levels of evaluation at LEAP. So the work that we've spoken about today fits in our in-house work at the bottom, but we also partner with the Dartington Service Design Lab, and they're conducting a local evaluation of LEAP itself. And we are also part of the national evaluation of A Better Start, where NatSen, in partnership with these other organisations, are looking at all 5 sites, and their work will include a sort of quasi-experimental element, which will hopefully give that kind of robust look at some of the outcomes data. And yeah, as I mentioned earlier, we're hoping to do more in-house with our data linkage. So yeah, making use of those administrative data sets to do some counterfactual analysis. And in our next annual learning report, which we're drafting at the moment, we're taking a greater look at that engagement data. So looking at families' journeys through services and looking at that kind of multiple service usage as well.
Thanks everyone for listening and staying with us till the end of the day. Sophie's going to be presenting tomorrow a more detailed case study of one of our services that wasn't mentioned today. That's an antenatal service, so if you want to hear more, and if you want to read more, that QR code will take you to the report that we've been talking about today. Thanks very much.